The benefits that have been researched and found are that it increases bulk to the muscles that are stimulated, it increases bone density to some of the leg bones, it enables cardiovascular exercise, which most of these clients in other situations are unable to do. It can help prevent diabetes. The FES bike also can help reduce body fat and reduce spasticity in muscles due to the nice flowing cyclic motion of the bike. And most clients' feeling of well-being outweighs any of those other benefits, as they are unable to see their legs move, which ordinarily they can't. The FES cycling bike also enables these patients to exercise and have that feeling of health and fitness, which in any other circumstances, again, they are unable to benefit or feel or actually see movement in their lower limbs. FES cycling is going to benefit clients with complete or incomplete spinal cord injuries, patients with multiple sclerosis or stroke or any other neurological conditions. And the most benefits, as with all of us, if you can do exercise 3 times a week for 30 minutes, you're going to get the maximum benefit. However, it can be included with your ordinary physiotherapy, the use of your standing frame or any other exercise that you commit yourself to. FES cycling, you need to be assessed by a specialist neurological physio, and at Physiofunction we would assess you first and look at your joint range, your muscle length to ensure that there would be no discomfort or pain whilst you were cycling. The cycling, we would increase the times from 5 to 10 to 30-minute slot. And all of that is tailored then to you as an individual. We can alter which muscles we stimulate and at what level we stimulate and how strong is the stimulation. And at any time it can be turned off. For some clients, they don't need the stimulation and it can just work as an active cycle, and they still get the same feedback on how much power, how much strength, and whether they've used their left or right leg. There is much feedback from the computer to the client, which enables their own feeling of well-being and some competitiveness. The clients that have used the FES cycle have a great feeling of well-being. They love the sensation and the visual feedback that they get from their legs moving, which ordinarily they don't, and from the computer, from the screen itself, in that they can see whether their left leg is working or their right leg, how much power. We can set a speed that they have to compete with, and we can increase the resistance. We can work it as interval training, or we can work it just for them to keep their joint range and movement. FES cycling is a good adjunct to neurological physiotherapy and does support. Plus also, they can be used here in our clinic, and for some clients they will have them and use them in their own home.